Welcome to this lecture in the course One Health, and my name is Håkan Vigre and I'm working at the Danish Technical University. The title of this lecture is Examples of how microbiological risk assessment has been used to improve human and animal health. After this lecture, you will be able to describe how microbiological risk assessment can be used to answer questions from stakeholders regarding human and animal safety or health. You will also be able to outline how lack of data influence the results on a risk assessment and outline pros and cons when using microbiological risk assessment. The use of risk assessment in the context of human and animal health, we have to say some general before we go to the examples. In risk assessment regarding human and animal health, the question is very often related to which interventions you can implement in the production of food and how we trade animals and so on to improve the health for humans and animals. So there is a question you need to answer. And when doing risk assessment, answer the question from the stakeholders, no more or no less. It's very important to stick to the question, to have a good communication with the stakeholders and the problem they are struggling with. So the risk assessment has a purpose, and the purpose is to answer a question from the stakeholders. Before we go on, I want to outline these four elements again of risk assessment. We always start with the hazard identification. And in microbiological risk assessment, the hazard identification is very often given by the stakeholders. They come with a question they address, and in that question they specify the hazard. And then we work with exposure assessment, how the humans or animals are exposed to this hazard. We also look at how the human or animals react on the exposure, and that goes to the hazard characterization. And finally, we bring these things together, exposure assessment and hazard characterization, and try to come up with a risk characterization. And the risk characterization also include the answer on the question. The first example I want to show you has the title Salmonella in pork meat in European Union. The aim of this risk assessment was to estimate the expected reduction of Salmonella cases in humans by reduction of Salmonella prevalence in slaughter pigs, and also to estimate the expected reduction of Salmonella cases in humans by specific control measures during the transport of pigs and the slaughtering process. So you see here we have the whole production line from farm through slaughtering to the consumer. So here we have an example where we include the whole chain from farm to consumer, and then we look at different steps in that production chain and look at how can the different preventive measures influence the risk for the consumer. How we did the approach to this question was to build a quite long model, because we have to address the whole chain from farm and transport to slaughtering to preparation and consumption at the private home, and then also to the risk character, how people consume and how they react on the exposure. So this is the overall picture, and what we did was to, can I scroll through here, is to break down it to, so here we have the farm and transport. We build small models for how piglets are raised in the farm, how the weaners are raised and how the finishers are raised and so on, and then the transport, and how different factors at these different steps influence the amount of Salmonella in the pigs. We did the same for processing at the cutting plant and the slaughtering. And we did that by a mathematical approach. We built a quite advanced mathematical model to describe this process. And this is just a very short example of the coding. I think we have more than 1,000 lines of codes. The pros and cons of this approach was that we were able to describe the whole farm to the consumer chain. And we were in that way also able to model how interventions early in the chain influence the risk for the consumers. So if you implement something at the farm level, how will that influence the risk for the consumers in the final end? But there was also some drawbacks of these things. And one of the things was that we had a lot of unknowns and uncertainties in the model. because the model was very complex, and when we built it, we realized there was a lot of steps in the chain we didn't have any knowledge to, or very limited amount of knowledge. And there was also a drawback with this advanced mathematical coding, because so many lines, there is a high probability that you do some errors during the coding, and it's not easy to find these errors in the final end. How has this risk assessment then been used by the stakeholders? The stakeholders in this sense was the European Commission, and it gave them a structure and deeper knowledge to the complex pathway of salmonella in farm-to-consumer chain, because it is a very complex chain. But no decisions have been done so far regarding regulation of how to reduce the risk for the consumers. The next example I want to tell you about is avian influenza in wild birds. In 2006, we have avian influenza flying around in Europe, so to say, in the wild birds. And we got the question from the industry about the evaluation of the risk of transmission to swine from these wild birds. And the background for this was that there was a worry that if avian influenza virus were transferred to pigs, there was a higher probability for some mutations going on and gene exchange between different influenza virus, and then also that could increase the risk for humans becoming infected by a high pathogen influenza virus. So what we did to answer this question was to build a conceptual model in a qualitative way. And here I don't think you see all the outline here, but we started out with a wild fowl, wild birds flying around, and then in the end of the model we had pigs. And in between we have all the possible transmission pathways, how the virus could be transferred from the wild birds to the indoor pigs. And as you've seen here, this is a very complex pathway. And we also have the transfer not only through animals, but also through the environment. Conclusion from this risk assessment was that the risk of infection in indoor reared pigs is very low to low, and the uncertainty associated with this estimate is high. And also that the risk of avian influenza infection in outdoor swine from infected birds or poultry found in a 3-kilometer zone is very low. And this uncertainty again is very high. And it keeps on also with the conclusion about the risk of horizontal transfer of avian influenza in swine. If you isolate virus from one single pig, is low. And again, the uncertainty is high. So what you see here is that we have used qualitative terms to discuss the risk. We also have addressed the uncertainty, and in all the cases this was high. And if we look at the sources of uncertainty, one of the big sources of uncertainty, so to say, was that we didn't know the prevalence of avian influenza in wild birds. The duration and the amount of avian influenza virus excreted from infected birds was unknown, and it went on with several steps of unknown factors. And here in the final step here, the probability of contamination of feed and water by excretion of avian influenza infected bird was also unknown. So all these steps of unknowns of course sum up to a very high uncertainty in this risk assessment. There was some pros and cons also here. The good thing was that we structured the understanding of the pathway or the pathways, and it also you could present that it was a very complex pathway. We also highlighted the lack of knowledge for the stakeholders. The drawbacks was that, of course, we have limited knowledge to the possible routes of transmission of avian influenza virus, and also that we lack the quantitative data of almost every step in the pathway. And that's why we have this high uncertainty. The third example is an example we did with foot and mouth disease, introduction of foot and mouth disease to Denmark. And the background for this, there was a discussion between the government and the industry that they want to remove the limitation of the size of herds in Danish animal production. Previous, we have a limit size of 500 animal units. That one animal unit is approximately one cow. So 500 was the maximum size. And then they wanted to remove that. And there was a worry that what will happen with the risk for introduction of exotic diseases, and in this case foot-and-mouth disease. The approach was the assessment was driven by assumptions, because we have very little knowledge to how high the risk actually is to introduce exotic diseases to Denmark. We know it's very, very low. By historical events, it's very unusual that we have the diseases introduced to Denmark. But we made some assumptions. The first assumption was that foot-and-mouth virus is introduced either by wind or by animals or trucks entering the country. That was the only possible pathways to have the virus introduced to Denmark. And also that the number of animals in Denmark will be the same even if we allow to have larger farms. So the overall amount of animals in Denmark will be the same. These are the driving assumptions, so to say. And also that the amount of animals and trucks entering the country will be the same. Yeah, I already said that. Okay. If we look at the first assumption, the assumption that the number of animals in Denmark will be the same even if we're allowed to have larger farms. Here we look at the pathway of having the virus introduced by wind. And then we look at the map here. We have Denmark here in the center. And historically we have indication that the virus has blown in from this part of Central Europe, Eastern Central Europe, to Denmark. And what's happened is that the virus dumped down in one or two animals and then infect the farm. But if we still have the same amount of animals in Denmark, the conclusion was that the probability for introduction by wind will not change. If we look at the next assumption, the amount of animals and trucks entering the country will be the same even if we allow larger farms. The entrance of animals and trucks is at the border here for Germany. And of course, when you're moving around animals, there is always a probability that you also move around some pathogens, some virus, some bacteria. But if we assume that the transport is the same across the border, again, we conclude that the probability for introduction by animals or trucks is not changing. There was some pros and cons also in this risk assessment. There was no need for any mathematical calculations, and that gave us the opportunity to make an easy communication of the output from the risk assessment. You don't need to be a skilled mathematician to understand what has going on in the risk assessment. The drawback is that the conclusion depends on that the assumption has a very high validity. If any of these two assumptions is wrong, the whole risk assessment fails, so to say. How has this risk assessment been used by the stakeholders? The limitation of herd size was removed. It was not only based on this result, it was also because of other factors influencing the decision. But that was the output from this risk assessment, that the stakeholders decide that we allow herds to be larger, we allow farmers to have larger farm size. The last example, the fourth example, is the assessment of the effects of changing salmonella surveillance in flocks of egg layers on human risk of salmonellosis. And the background here is that the Danish Food Authority and the egg industry wish to change the ongoing surveillance program based on serological methods on eggs to a more intensive program based on floor samples in the stables where you pick droppings from the floor and a PCR method. And in that context, they wish to estimate how this change of the surveillance system will change the risk for the consumers getting salmonellosis due to consumption of the eggs. So now we are back again to a risk assessment where the output is the risk for the consumers. And the change is very early in the production line in the farm. The way we solved this was to build a stochastic Monte Carlo model which could simulate the number of eggs entering the retail and the consumers before the infected flocks were detected. And then we could simulate different sampling procedures and frequencies and lab methods in that model. The probability of infection of flocks and layers within the flocks were based on real data, so in this case we had some data to work with. We assumed that the relative change in risk for consumers was equivalent with the relative change in the number of contaminated eggs entering the retail and consumption. So if we were able, by the surveillance system, to reduce the amount of eggs entering the retail, we also reduce the risk for the consumers in a linear relationship. And we focused on the relative change, not the actual number of infected eggs or the actual number of consumers getting ill. It was the relative change of the risk for the consumers we were focusing on. And we simulate that in an Excel spreadsheet, and it was not so complicated after all. How had this risk assessment been used by the stakeholders? The surveillance was changed and is now based on a floor sampling technique once a week and a PCR method. So it's more intensive and we have a faster laboratory method to give the answers. And in that sense, the number of eggs, if the flocks are infected, before we detect the flock as infected, the number of eggs coming out is not as high as it was before. And table eggs for sale in retail are now labeled as tested free of salmonella, actually, because the surveillance program now is so intensive and have a so high sensitivity to pick up infected flocks. The pros and cons here is that, the stakeholders were involved in the development of the model. And when we involve the stakeholders, they also understand the model, and in that way they have confidence in the results. There was no big discussion if the results were valid or not. The industry and the stakeholders have a confidence in the whole model. The drawback is if consumers start to consume non-heated treat eggs, and maybe that the risk will increase when compared to before the change of the surveillance. But that was outside the focus of the risk assessment. But the decision made of risk assessment also can starting up new problems, so to say. And also that the uncertainty was not very well integrated into the model we built. So we were aware of this uncertainty when we communicate the results. This was the 4 examples, and if we zoom up based on these 4 examples, the first point I want to stress is that risk assessment should be done to answer questions that can help stakeholders to implement the most effective interventions to improve human or animal health. There must be a question to drive the whole risk assessment. The second point is that the validity and usefulness of a microbiological risk assessment depends very much on how you, as a person, how you understand the conceptual process, because that have an influence how you build the model. And we saw that in the avian influenza risk assessment, how we thought that the pathway will be for avian influenza, so to say. So the conceptual understanding is very important. Assumptions make it possible to simplify the reality, because when we build models, we simplify the reality. And in that way, we can actually model the thing. But at the same time, we move away from the reality. So you always have to be aware of that. When you simplify things and put it into a model, you're not simulating the real world, so to say. You are simulating a model, and then you can try to take these results from the model and interpret them in a more broader sense to the reality. But be aware of that it's only models we're working with. Also that if we used advanced mathematical models, we're allowed to assess very complex pathways. And we saw that in the example with salmonella in pork meat, where we build a mathematical model describing the whole pathway. But at the same time, it can be hard to communicate the results based on these mathematical models. And that is also extremely important to be able to communicate the results you have and what you have done in the risk assessment. Because if you are not able to communicate, the stakeholders doesn't really believe your results, and then it's useless. And the final point is that lack of data is very often the limited factor in the risk assessment. We very often lack data at different steps in the risk assessment. But on the other hand, risk assessment can then identify the most important data gaps and thereby be used as a guidance for further data collection. So don't be afraid of lack of data. It's just a limitation, but you have to accept that we'll lack data and work in the risk assessment anyway. Okay. That was the end of this lecture. Thank you.